Hello, my name is Cheryl Long. I am a Bryan and Stratton student. I am a medical assistant and I've worked in the medical field for 17 years. I'm here today to talk to you about hand hygiene and how it's our best defense against disease. After speaking with you today, hopefully I've encouraged you to wash your hands, wash them often, or use an alcohol-based hand sanitizer before and after contact with patient or patient equipment. Our hands are our tools for physical contact. And in the medical field, they're more than just tools. They provide total patient care, which means we touch our patients and all equipment and material that will come in contact with our patients. And then when we're in our environment and we touch things, we transmit germs to our hands. Then when we touch the equipment or the patient, we are transmitting germs, causing disease, illness to our patients or infecting the equipment. The CDC suggests that we wash our hands with soap and warm running water for 20 seconds. This reduces bacteria count. The time that it takes to wash our hands is not just important, but it's also how we wash our hands, making sure we cover all areas of the hands, palms, backside, in between fingers, and wash up the wrist. The CDC noted a study that was done in an intensive care unit. The nurses demonstrated it took 62 seconds to leave a patient's bedside, go to the sink, wash their hands, and return to the bedside for patient care. In contrast, an estimated 1/4 of the time was required when using alcohol-based hand sanitizer placed next to the patient's bed. Promoting an improvement in hand hygiene and sanitary conditions in the health field have been a challenge for more than 150 years. A practice nursing theory today is the one by Florence Nightingale. Her mission was to improve hygiene practice and sanitation and sanitary conditions for our patients. When we touch things in the environment, then we touch surfaces and we touch patients, we can be transmitting diseases to these patients. One of the diseases that can be transmittable is cold and influenza. It's a respiratory illness. It is spread through droplets of breath when sneezed into the air and coughed by someone. Gastroenteritis can be spread if you don't wash your hands after having a bowel movement, changing a diaper, handling vomit. We touch food trays, bedsides, patient touches their mouth. Disease has been transmitted. There's also superficial eye and skin infections, such as bacterial conjunctivitis, chickenpox, measles, or rashes. Hand hygiene is our most powerful defense against germ transmission. Us healthcare workers are busy, and I get it. Just keep in mind that by not washing your hands, you're not putting only you and your patients at risk, but other healthcare workers at risk as well. So wash your hands or use alcohol-based sanitizers every time before and after touching a patient or the equipment, and you will be reducing the risk of germs. Keep it safe and keep it clean and keep washing your hands. Have a good night.